Awesome. We're super excited that all of you are here to learn more about our program. Sam, that's me, Emma, and David we're the three co-chief residents for the University of Colorado this year. Um, these are just some fun pictures of our group of residents doing fun things throughout Colorado. And then just as an overview, we're going to kind of breeze through a lot of information, and then we'll save some time for questions at the end as well. But this is our leadership among the program. So our chair is Dr. Akathoda. He is really wonderful, and we also get to spend time with him clinically in spine clinic and in the procedure suite. Our absolutely incredible program director is Dr. Miron. She's the best cheerleader for absolutely anything that any resident wants to tackle during their time in the program. Our associate program director is Dr. Vera Staley. She's also just wonderful and very supportive, really wants to work on building individualized learning programs for residents and is also a champion of everything in the program. And then our behind the scenes absolute rock star is our program coordinator, Mallory. So she does everything that kind of keeps this program moving for us and deserves all the credit for all of the wonderful things that our program offers. Again, we have three chief residents. So my lead is on recruitment. David's lead is on all of the clinical things, and then Emma does didactics and education. And then I think that one of the strengths of our program is all the different clinical sites that we rotate through. And so the UC Health Hospital System is our university hospital. We spend a variety of months here on inpatient, consult, and outpatient rotations. We spend about a year of our time through training spread out over our 3 years at the VA hospital as well, which has a spinal cord injury unit, inpatient rehab, and a lot of outpatient rotations. And then Denver Health is our community hospital for a lot of patients who are under or uninsured, and we do consults and outpatient rotations there. And then Children's Hospital Colorado has a really robust inpatient and consult service for pediatric rehab for a 7-state catchment area, so that's a unique experience as well. And then the standalone hospital that we work at is the Craig Rehab Hospital for spinal cord injury and brain injury. And this is another phenomenal opportunity to get really, really in-depth experiences in neuro rehab. We also have very robust exposure to procedures. And so kind of regardless of what you want to go into, you have many, many opportunities to get tons of hands-on experience. And we're never really fighting with fellows for these opportunities, especially if you want to go into things like sports or pain medicine. You're going to get more than your fair share of spine procedures, peripheral joint injections. And even for those who don't want to pursue those subspecialties, you still end up feeling really competent in all of these different procedures. Just a very brief overview of our call structure. So we do take home call, and so we are on call from Friday to Friday, and we have two different call pools. So one at the VA hospital and one at the university hospital. For both of those sites, we do go in and round on Saturdays and Sundays. For PGY2s, they take 10 weeks of call. PGY3s take 7. And then PGY4s take only 2 weeks of call. And so if you're not on call, your weekend is free. We never work on Saturdays and Sundays otherwise. And so that's a really awesome thing to experience when you're living in Colorado and you get to enjoy all of that time off. We also get 20 vacation and education days for things like conferences and 10 sick days. In terms of mentorship, we have formal and informal opportunities. So formally, every PGY2 is assigned a faculty mentor based on their interests. And then we also have subspecialty interest groups for pain, sports, neuro, and pediatric rehab, which again provides opportunities to interact with fellows and faculty, get opportunities for research projects, volunteering experiences. And then informally, we have alumni throughout the whole country. And so basically for anything that you would want mentorship on, whether it's professionally or personally, there's somebody that you'll be connected to. And then a lot of our residents are really strong leaders, both internally within our department and then nationally as well. And so this is just a brief list of all of the different leadership opportunities that folks have done in the last year or two. And so internally, there are things like leading the medical student interest group, being a wellness liaison to the GME, serving as a subspecialty interest group leader, having a leadership role in one of our volunteer clinics. And then nationally, our residents every year are involved with PM&R committees, AAP committees, and then other opportunities as well. And anything that you're interested in, our program would happily support to make sure that you're getting all the things that you need to be successful in your residency program. And I'm going to turn it over to Emma.
Hey guys. Yeah, I'm Emma. I'm the kind of academic chief lead. Nice to meet everyone. So to further explain our program, I think another benefit to the variance in our clinical experience is we are able to support a lot of different postgraduate plans, and that pathway might look different for most of our class. For example, we have a few residents who are also not pursuing fellowship, which I think is also a really good indication of the strength of your training through the first 3 years, knowing that they feel prepared to enter the field of general PM&R based on what we've experienced just without the fellowship training. So beyond that, though, we have quite a variance in where people go post-graduation for fellowship. Here's an example of just the last few years. But actually, you can progress, Sam, because I think another highlight of our program is the fact that we do have 4 fellowship opportunities within the CU system. And not only does that mean you have, the opportunity to continue within CU, but also you have direct exposure to specialized training alongside the fellows. But that means that the faculty involved with creating the curriculum for the fellows are even more in tune with what, a special focus on these particular areas of interest within PM&R. So pain medicine, sports medicine, pediatric rehabilitation within Children's Hospital, and then spinal cord injury medicine is within Craig Hospital. So varying settings as well. So it speaks kind of the strengths of our program further. Education beyond just the clinical experiences, we do have our Wednesday didactics. They're protected education time in the afternoons from 2 to 5 p.m. These are faculty-led, and we have really intentional didactic blocks that are the goal of them being kind of a 3-year longitudinal curriculum, and so you're not getting repeated information. Certainly, there are some overlapping topics that we talk about every year, but the goal being you're exposed to a wide variety of PM&R topics over the course of your time in our program. And further, there are opportunities to be I guess we have the AA PM&R memberships paid, and on top of that, we have education funds that you can use for any particular interest of yours. That can include supplies or subscriptions or to various educational resources, membership dues that aren't AA PM&R, and essentially anything that you can think of and can spend to the program leadership. We also have access to butterfly ultrasounds at all times that we rotate between residents, and that's a really valuable way for you to kind of enhance your time both on spine and sports rotations, but just in general, kind of optimizing your procedural skills outside of the clinical setting. So further on didactics, we do have really hands-on workshops for EMGs, for ultrasound. Beyond that, we have pretty extensive intro lectures that include anatomy lab at the start of the year every year. And then we have workshops that are both within didactic hours and also outside of that for our interest groups, which is also super exciting. Our didactics are, again, really interactive. And so we have a lot of faculty are really engaged with adult learning and medical education. And so they've definitely progressed in their sophistication. And I think we've done a great job of making them better every year, which is hard to say because they're already great. And so the bottom corner is also wheelchair clinic. We get some opportunities to be outside of our academic office and lecture hall and do community events that are engaging with different groups that, either we have wheelchair clinic and a few different DME companies that we get to work with and kind of have hands-on experience with equipment, which I think is very valuable for us as PM&R residents. So we have additional tracks that we're trying to expand upon within our program. So the global health track was the first one we initiated last year. We had one of our residents who actually helped build that track, and that's expanding. And then beyond that, we have our medical education track. And so, the goal we have 4 others in pilot that we anticipate starting hopefully next year. But then essentially it speaks to Dr. Miran's vision for optimizing and kind of supporting our more specific interests as residents. And so it builds up your resume and your clinical experience. And then outside of that, the residents and fellows as educators elective is actually a general GME elective. So it's not PM&R specific, but we definitely take advantage of it as residents. Multiple graduate, or I should say PGY4 residents have done it most years. So lots of opportunities. And then conferences, yeah, we have great representation of, the big main conferences, AAP, AAP&R, but many beyond that that go kind of within any specialty interests that you might have. Lots of publications to, I guess we're excited that our research is expanding within our residents, and we have a really good group of faculty who is actually trying to expand our didactic block and research related didactics so that we can have more representation at future conferences. But it's a really good opportunity to meet other faculty outside of CU, and we tend to go as groups, so we have social events that are planned as well. And speaking of social events, we tend to hang out organically a lot as a team. But beyond that, we do have kind of more sponsored or special events that we like to do throughout the year. We have designated wellness funds that our department has been so kind to share with us. So we get to do outside events that, maybe we wouldn't have thought of. So here's some examples of that. But the top corner is also our retreat that we do every year, which is something we try to do at the start of the academic year to meet all the new PGY2s and kind of just build that camaraderie from the start. We really appreciate our co-residents. I think all of us can speak to our team is feeling more like a family than colleagues, which, yeah, it's an amazing place to be. I think David, volunteer. Yeah, we have many volunteer opportunities that are kind of adjacent to CU, so certainly not required, but we have a lot of resident involvement. Some I'm going to highlight are the adaptive sports through Arch, and Sam is definitely a very active volunteer in that. I'm a patient coordinator for the RSVP clinic, which is a rehab medicine clinic that we do monthly. It supports those without insurance. And then there's sideline coverage for those more interested in sports. And then the medical student interest group. A lot of us are really engaged with medical education. And so getting connected with CU and RVU students is a highlight as well. I think David's on.
All right. You guys can hear me okay?
Yeah.
Sorry, I'm calling from my car. Nicely, we have 2 weeks of call PGY4 here. I just happen to be on one of those weeks right now, so thanks for bearing with me. So yeah, I think a lot of great things have been kind of highlighted, right? Like wherever you do residency, right? Like you're gonna get good training in various things, but you want to go somewhere that feels like it kind of fits with who you are, what you like to do, and things like that. We try to be really big about kind of hanging out outside of work, and this can take a lot of forms. I think it's something I appreciate about kind of my co-residents is, you know, some people like to hike, some people like to ski, some people like to do other things, and we have a slide coming up about that. But there's a lot of things to do. It's a very outdoorsy place. It's good weather. The annual retreat every year is really fun because it's a chance early on, within the first month or so to kind of meet other people in your class, right? You come in as a PGY2, you might know a couple of people, but you don't really know them outside of work. And I think it really sets a good foundation just to make sure that everybody feels kind of supported going into the year before call starts and things like that. It's always lots of fun, as you can see by all the pictures right there. But I think it's a really cool thing that we do as residents to kind of just bond a little bit outside of the workplace, because it makes it, when you work with those people every day, then it makes it even more enjoyable. Yeah, next slide, Sam. Cool. So celebrations, holidays are fun, or just anything. I think, we've done baby showers, we've done birthday parties, we've done sporting events, right? Where we'll have barbecues and watch sports and things like that. Pumpkin carving has been an annual thing at Sam's house. We've gone to Top Golf. Halloween, obviously, some of the sites are like insanely into Halloween. Like everyone dresses up. It's amazing. It's really fun to kind of see that, and just kind of any way you can kind of connect with people and make it enjoyable to be at work, I think is always going to be something that you want in residency, you want in co-residents and colleagues. Just make it a more enjoyable experience. Next slide. And then, I mean, Colorado, right? I think people think about it as being a very outdoorsy place to be, and it is, right? It's lots of mountains, there's water, there's snow, there's a lot of road cycling, there's a lot of people, I would say, from a community perspective, that enjoy the outdoors. You know, a lot of people are not in medicine and they enjoy the outdoors, and that's kind of what brings them to Colorado in general. And definitely, you know, a lot of our residents enjoy the outdoors, but certainly not everybody. I think that's the great thing about it, is you kind of have a good mixture of people that, you know, want to be outdoors, and sometimes people like indoor activities. But the reality is just a lot of things to do, and it kind of gets back to like quality of life and the amount of weekends you have available. And when you become a third year, you don't have to work holidays and things like that. There's just a lot of new things to do. If you're from Colorado, then you probably think that already. But if you're, you know, coming from somewhere else, it's just important to consider, right? Like, is this a place that I might enjoy living? And I think Colorado is definitely a place that a lot of people on average just enjoy living. Slide. But, and this was the punchline, you know, you don't have to hike and ski. And I'm so glad that I got to present this slide, because I don't really do either of those, to be honest. But there's still a lot of things in Colorado that I like to do. These are, again, just more pictures of us. This one at Syrup we do like an annual residency feedback session, basically, where we get the entire day off to go out to brunch paid for by the apartment, give feedback on all the rotations, you know, things like that. Just any way to improve the program. I think Sam mentioned at the beginning, right? Dr. Miron has kind of taken over as program director, and she is like the most, you know, welcoming of feedback, welcoming of new ideas. One of the most people I know, and that's kind of what you want. But there are other things to do. I like to golf. Some of our other colleagues like to golf as well. Going to sporting events, road cycling. Honestly, I just like walking around my neighborhood, to be honest. It's just like nice for a good portion of the year. So you don't have to hike or ski, but there are many of those opportunities, and many people do. But if you don't, you'll certainly find people that, you know, also have shared interests as well. Next slide. And then as far as program updates, so one of the things that kind of in years past, I would say, before Dr. Miron took over, is that we didn't really have a couple of opportunities that we do have now that I think are really cool. We didn't have electives, right? So a lot of the rotations were kind of, you know, here's what's available to you. I think it was a very well-rounded program to begin with. We had exposure to inpatient, outpatient procedures, all kinds of things. But now we have electives. So if you find that, you know, after second year, you're interested in sports medicine, you can do a sports medicine elective. If you find that you're really interested in pain medicine, injections, you know, neuromodulation, you can do, you know, an advanced spine or advanced pain rotation. Or if you find that you're going to be somebody that's really into like neuromuscular disease and things of that nature, or maybe doing a variety of PM&R things in your practice, you can do an advanced EMG. So now we have the elective rotations, what I think people really like. And in some of those advanced rotations, you also have built-in research time, where you're going to get dedicated time, typically a Friday. So it's basically a 4-day rotation, to work on research projects within the department. And so I think those are really cool. Other thing is just kind of expanding the research curriculum. You know, we've done projects where we're collaborating with the medical schools here in Colorado. I've collaborated with other universities, which is always a fun time. And then just collaborating with your attendings and colleagues can always be great. There's always case reports, case series, and things like that. Canvas page has been updated so much in the last couple of years. Basically, everything's nice and lined up. Emma's kind of in charge of making sure each module has, you know, pre-work, quizzes, things like that. Very low stakes, but it adds some structure to your education. And then the 3-year didactic curriculum. So you're seeing all of the topics that you need to be successful on boards multiple times. You can also have individualized learning plans. Probably don't have the most amount of time to dive into that right now. But the point is that this is very much a, you know, make of it what you would like in a way. There's certain requirements ACGME has to follow, but, you know, we really want you to have an experience and make this educational process and residency what you want it to be. And then additional expansion of the subspecialty interest groups as well, which I know we kind of briefly talked about already. Next slide, if we have one. Cool. So then, yeah, I think just kind of bringing it home, YCU PM&R, variety of rotation sites. You know, you might think you know what you want to do, but you're not fully sure. I think it's good to go to a program that's very well rounded, and I think they offer that here. You get children's, you get VA, you get university, you get you know, catchment hospital, things like that. tons of autonomy, tons of exposure. I think we have some of the highest procedural numbers in the country, to be honest. And then the home call schedule, I prefer. It's a teetering schedule. It gets less and less each year. Really good support, easy to contact the attendings. It's something that I think is pretty manageable overall. Mentorship, you have formal, you have the subspecialty interest groups, you have your co-residents. There's so many ways to get involved with different mentors and kind of meet new people along the way. And then just in general, life in Colorado, right? Built-in wellness, people definitely prioritize a work-life balance. And that's definitely a desirable thing in residency because it will have its tough days, but you want to feel supported and have a good balance at the end.
Sorry, that time went by really fast. If we don't have time for questions, then feel free to reach out to any of us through email. But let us know if we have a minute or two for questions.
Okay. Thank you so much, Sam, Emma, and David, for taking your time to speak with us about your residency program. We really, really appreciate it. And as Sam just said earlier, if you have any questions, please email them. Their email is on this slide, or you can email the Pathways to PM&R directly, and then we can probably send them out too. Okay. All right. Thank you so much. And then what we have next here is Emery from University of Arkansas. Emery, you ready?
Hey, how's it going? I'm actually going to be taking over primarily for the presentation. Also, if you need to, we're fine with going a little later to give Colorado time for questions, if that's allowed.
Oh, let's see. Are they still on? Is Emma, Sam, and David
We're
still on? Okay.
Yeah, up to you all. We can also just message in the chat. I just don't want it to distract from your presentation. So whatever you all want to
Totally
do.
fine. Totally fine with us. If Pathways will allow it, absolutely. I'll take a couple minutes.
Sure. We'll
Thank
do
you. That's so
up
sweet.
to
That's so
we'll
nice.
do up to
Thank you.
5:30. Thank you so much, Neil. Okay, so we're gonna open up the floor for questions till 5:30. Thank you, Neil, for allowing us the time. So the floor is open.
I'll start with,
Oh, go ahead. Sorry. Can I ask?
yeah. I was going to just start with your question in the chat. That's
Okay.
perfect.
Well, yeah, I guess as I type, yeah. Have you guys felt like over the years more autonomy, but like still like well mentored, especially on the inpatient side, but also outpatient side, that you've been getting like more ready to practice on your own down the road?
Yeah, I think in general, on every single rotation, every attending is supportive of seeing where we're at from like a knowledge-based perspective and how we feel interacting with patients and counseling. And they take that and really push us to improve our skills in a wonderfully supervised way. But I think that our autonomy grows so naturally throughout the 3 years, both inpatient and outpatient. And you see that working with patients on the consult service, doing procedures in an outpatient setting, managing clinic patients that are follow-ups. And so I do really feel like each faculty is so intentional about making sure that we're ready to graduate from training. And again, not all of us go into fellowships. And so they really do make sure that we're ready to practice and be in attending by the time we graduate. So I think it's great.
Thank you. Appreciate it.
Okay, Akash in the chat says, has anyone been able to do something similar to the medical education program and also still have time to do research?
I do both of them. I think I like research, and I kind of started doing that early on. The medical education track kind of came about as a newer thing. The medical education track I think is really enjoyable and fun, but it's not like a time commitment. We meet like once a month for an hour. It's protected time you can get off of your service. It's with Dr. Miron, our program director, who's like an education superstar, right? Like those skills are very transferable to being a program director. Occasionally, like there's a little bit of reading or like small little chalk talk projects and things like that, but it's certainly not an overly burdensome thing. It's really an enjoyable thing to do. So honestly, like maybe a half an hour of prep plus an hour session a month. And then so with balancing research, right? Research is very much kind of on your own time, but there's also a question about how that works with the electives in the chat. So maybe I'll double dip here real quick. Basically, you can have a research project that's independent that you can create and build on your own, or you can find a faculty mentor who's doing research. And people that come here, we get them plugged in, like, here are the people that are doing research and publishing, like, here's who you would want to talk to. And in fairness, in academics, that's not everybody. And so it's, we're able to kind of help foster those relationships and get them started so that you are working with somebody who has experience and kind of help you build experience as well.
It's 6:30, and I just want to be really respectful of the next group's time because that was so nice of them to share. But feel free to reach out via email if you have more questions. I'll try to keep tackling them in the chat. But thank you all so much for being here.
I just want to highlight one quick thing, Sam, because I think there's been a consistent message from you that I just want to reinforce, and that some of you guys have asked really great questions and come up with some really interesting ideas for opportunities within your residency, and seeking those in a program is amazing. I think to highlight, CU would support anything that you would bring forward. There have been many examples of new additions to our program that have been spearheaded by residents. So just want to highlight that faculty is here to support you, and if you have a motivation to add something new, both either for yourself or for your colleagues, I think there's definitely an opportunity too. So thank you all for your great questions.
Well, thank you again, Sam, Emma, and David, for their time, and thank you so much for Neil and the University of Arkansas for allowing University of Colorado to answer some questions. That was really, really appreciated.